Endometriosis so often has as a leading symptom painful periods, painful menstruations, invalidating menstruation. We must know that to menstruate we need a limited process of inflammation, helping the endometrium within the uterus to shed, to live and allow the menstruation. As I said, a limited inflammation with these characteristics: finalized to renovate the endometrium, short in time, just the time needed to renovate, and moderate in intensity. This is a physiologic inflammation, friend of our health, and just to let you know why inflammation can be a friend of our health, just think that ovulation, menstruation, and delivery are three normally inflammatory processes, friends of our health, but they must be finalized, limited in time, and of moderate intensity, when moderate means just sufficient to renovate and complete the process. When we have endometriosis, the inflammation shifts from physiologic to progressively pathologic. It becomes chronic, the duration becomes over months and years, of persistent intensity that becomes more and more severe, and it has no purpose. It just destroys the tissues. So, these are the characteristics of a pathologic inflammation. Menstruation means inflammation, but in endometriosis we do have a pathologic inflammation. That's why the first goal is reduce the hormone-free interval if we take a pill or a patch or a ring. By reducing the interval, we reduce the inflammation and we reduce the symptoms. There are plenty of data on this. If you go to my website, English section, you can download a scientific paper. The title is very, very clear. The shorter, the better. A review of the evidence for a shorter contraceptive hormone-free interval, and you can read all the scientific evidence that supports my claim. So, regimen is key, and we can start contraception with a therapeutic purpose even in a very young girl. When she has painful menstruation, stop pain, because as I said, we reduce inflammation, but also we reduce the progression of a potential serious endometriosis. What are the strategies? Reduce the hormonal fluctuations. Why that? Every menstruation is due to a loss of estradiol and progesterone. So if I reduce the fluctuation, I reduce the most important triggering factor to our soldier, the mast cells, to shoot in the tissue, to release that content and increase the inflammation. The second point, as I said, strategy, reduce the hormone-free interval, the number of periods, and the inflammation. When I recommended this, usually I have the young girl and the mom in front of me. And when I say my first suggestion to reduce this painful menstruation is to reduce the hormone-free interval or reduce the number of periods, usually the mom jumps on the chair. Ah, no, doctor. No, my daughter needs menstruation. Yes, of course, but she does not need the pain. So my suggestion, reduce the menstruation to a menstrual whisper or silence. Why that? Because if I have the whisper or silence, I have a symptom silence. Immediately a young girl jumps on, yeah, doctor, yes, I don't want symptoms anymore. Mom, I don't want symptoms. So I said, my lady, at least let's have a try. The treatment is absolutely safe, effective, data are very reassuring, and if the result of this treatment is that your daughter gets back to a normal life and if we have an endometriosis, we reduce the progression of the disease. What else? Let's have a try. Yes, yes, Mama, let's have a try. So, regimen is key. Clear? I hope you will read the paper and then discuss with your doctor if this is the perfect treatment for the first phases of this disease.